Hello, my name's Douglas Anderson and I'm a surgeon at the University of Alabama at Birmingham. I want to thank you for your interest in our kidney transplant program. In this video, we're going to discuss what to expect when an organ potentially becomes available to you. Should an organ potentially become available, you'll be contacted by one of our coordinators. They'll ask you how you're doing and whether or not you've had any changes in your health since the last time you were seen in our clinic. Should it become likely that this organ will be allocated to you, they'll contact you again and ask you to come to the hospital. If you live a few hours away, that's okay. We would ask that you safely drive to Birmingham and come to the hospital, but we do ask that you come in right away. Once you arrive to the hospital, you'll be admitted to a hospital room where you'll meet our surgical and nephrology teams. They'll review all of the evaluation and testing you've had thus far and update any testing that may be out of date. At this point, there are no guarantees that this organ is going to be placed with you. We continuously receive new information about the donor, which may change our opinion as to whether this is an appropriate organ for you. Additionally, we have to do any final matching to make sure that this organ matches you and is at lower risk for rejection. Once all of this is confirmed and this organ is allocated to you, then we would proceed to the operating room to do the transplant. Once we're in the operating room, the anesthesia team will get you off to sleep. Once you're asleep, they'll help us by placing a large IV in your neck that'll allow us to give you medications and immune suppressants during your hospital stay. We'll also place a catheter into your bladder to keep the bladder empty while it's healing from the transplant operation. The operation itself takes a few hours to do, and what it involves includes making a small diagonal incision across the lower part of your belly, somewhat from the point of your hip to where the pubic bone comes together in the middle. Once on the inside, we'll get access to the blood vessels, both an artery and vein, that go to your leg. We'll attach the kidney to those blood vessels to give it a blood supply, and we'll attach a structure called the ureter, which carries urine from the kidney to your bladder so that the urine the kidney makes comes out normally. As I said, the operation takes a few hours to do. The risks of the operation are very similar to most types of large abdominal operations. Things like bleeding, infection, wound issues, and hernias are all possible. We'll protect everything else in your belly as best we possibly can, but there is a small chance of hurting something in the process. Issues with the connections we make, either to the blood vessels or bladder, are rare, but they're a big deal when they do happen. Issues with the blood vessels affect the blood flow to the kidney, and issues with the bladder connection mean that the urine the kidney makes is not getting to where it needs to be. Not only do these threaten the function of the organ, but they sometimes require an additional operation in an attempt to fix them. Other risks to talk about, including the possibility of fluid collections developing around the kidney. Sometimes we will leave a drain next to the kidney that comes out your side, and that will stay for a variable number of days. There are rare complications of anesthesia, such as heart attack or stroke. Sometimes we put the kidney in and it doesn't work right away. The good news is most of these kidneys do start working given time, but may require additional evaluation in the post-operative period to ensure that we expect the kidney to start working. After the operation, you'll be in the hospital for an average of about a week, although that may be shorter or longer depending on your individual course. While you're in the hospital, you'll slowly advance your diet back to regular food. On the first or second day after the operation, we'll start getting you up and moving you around so that you get back to walking and moving around. The catheter placed in your bladder will stay for at least 3 days, but maybe longer depending on individual circumstances. You'll receive additional doses of IV immune-suppressing medications, and you'll be started on immune-suppressing medications in pill form. You'll actually receive your first supply of your immune-suppressing pills while you're in the hospital so that you have it in hand when you leave. At the end of your hospital stay, you'll be discharged from the hospital, but we do ask that you stay within the Birmingham area for about 3 weeks total. You'll have many clinic visits and laboratory draws during those first several weeks, and it's helpful to have you close by should any issues arise. Other potential risks to talk about include the risk of infection. We test donors for things like hepatitis and HIV. The tests we use are very good, but there's always a tiny chance that the test may have been wrong and that infection could have been transmitted with the organ. This is a rare complication, but can happen. Prior to leaving Birmingham, the stent placed across the bladder connection during the operation will be removed. This is a brief outpatient procedure, and just something to be aware of that will be on your schedule. We encourage you, if you have any questions about this video or any other part of the process, to write those down or contact your coordinator. We want to be sure that any questions that you have are answered. I want to thank you again for your interest in the kidney transplant program at UAB and for watching this video.